My name is Karina, and I did my signature assignment on an article named Second and Third Trimester Placental Hemodynamics and Risks of Pregnancy Complications. In this article, the scientists decided they wanted to know whether the uterine and umbilical artery resistance indices are influenced by maternal demographics and lifestyle characteristics. All 7,660 pregnant women in the study are being tracked from the second and third trimester. This study started in 2001 and ended in 2005, and it was located in the Netherlands. This article shows that there is a correlation between pregnant women with risks of developing preeclampsia, preterm birth, gestational hypertension, and small size for age at birth, and these women's lifestyle, characteristics, and demographics. This analysis was embedded in the Generation R study, which is a population-based cohort study. This study involves prenatal recruitment. Estimation of the precise number of eligible pregnant women is difficult, since there is no satisfactory registry of pregnancies. The response rate of the study was calculated at birth as the children formed a prenatally recruited birth cohort. The response rate at birth was 61% and reflected the number of children born to mothers living in the study area who are also at their delivery date and participating in the study as a percentage of the total number of children born to mothers who fulfilled these eligibility criteria. This rate also reflects the percentages of women from minorities and lower socioeconomic statuses, and that the results were lower than expected from these minorities and lower socioeconomic status. The results from them were lower than expected. In total, 9,778 women were enrolled in the study. 91% of these women were enrolled during pregnancy. Gestational age was established by fetal ultrasonography during first doctor's visits along with maternal age. For each pregnancy period, height and weight were measured and documented. Also, information on educational level, ethnicity, parity, and use of folic acid supplements was obtained at enrollment. Some more information that was collected and documented were the use of smoking and alcohol consumption, how often they used it and if they used it at all, and what they used. This was all assessed by a confidential questionnaire. These women did these questionnaires every trimester, so twice throughout their pregnancy. Placental vascular resistance was evaluated with recorded flow velocity waveforms from the uterine and umbilical arteries in the second and third trimester. Raised indexes indicate increased placental resistance. Since this type of measurement was done at only certain research centers, only 7,725 women received measurements of the indexes. Information on pregnancy complications was obtained from medical records. Gestational hypertension is defined as systolic blood pressure of 140 or greater, and diastolic blood pressure of 90 or greater after 20 weeks into their pregnancy. These criteria, plus the presence of proteinuria, were used to identify women with preeclampsia. Gestational age at birth, birth weight, and offspring sex were collected from doctors and hospital registries. Preterm birth is defined in the study as 37 weeks or less. There were multiple results that showed in this case. It shows that UARI tracks moderately during the terms, and UAPI tracks poorly during the second and third trimesters. In total, 271 and 150 women developed gestational hypertension and preeclampsia. 382 and 380 children were born preterm and SGA. Non-response analysis showed that women without placental resistance index measurements weighed slightly more and were more frequently less educated. Also, these non-response women were of non-European descent. In the beginning, when they were choosing which women would be in the study, some of them presented with no placental resistance index measurements. If these women were kept in the study, it would lead to biased effects. These women that were non-responsive might have affected the results of the study. It may have swayed the results one way or the other way, therefore making it biased. There were minimal cases of preeclampsia and gestational hypertension, which can indicate healthy, low-risk population. All of these results supported the hypothesis that depending on the pregnant woman's lifestyle characteristics and demographics, even though the numbers were low, that sometimes this may affect the result of the health of your birth, of the health of your baby, and the health of yourself while pregnant and at birth. Further research is still needed to assess the accuracy of placental resistance index measures. Around the time of picking these articles for the signature assignment, so in week 2, my cousin gave birth to a beautiful baby girl. So coincidentally, there was an article on pregnancy and it happened to catch my eye. Also, my best friend has a baby with special needs. He was born with spina bifida, so this has been very hard on her. She thinks it is her fault. So many times we have had conversations that if she could have done anything differently or not have done something that could have prevented this disorder. Lots of times when this happens, when the baby is born preterm, the mother thinks it's their fault, that they did something wrong. And that's not always the case. Like in this study, it says that the characteristics of their lifestyle and their demographics and their socioeconomic status, that those can all affect pregnancy and birth of your child. So with that being said, with those common stories in my life and seeing this study, I thought it was a great article and it was highly appropriate, and I've learned a lot from this article. Thanks.